My name is Matt Gilbert and I am a clinical hypnotherapist and I train therapists. So today we are going to look at the anatomy of a panic attack. What are they? Where do they come from? What kind of experience is it for those who haven't had them yet? If you're anxious, you don't want one, let me put it that way. And what we can do about them. So, panic attack, the key is in the name. They are a state of complete overwhelm of your senses, your mind, your body, any good thoughts that you have go out of the window, and all those things are replaced generally with discomfort, racing thoughts, and a sense of absolute doom and gloom and fear. They're not good. They are extremely, extremely vivid. So therapists describe a panic attack as a fully developed state of anxiety. In other words, that is as bad as it's going to get. Now, for some people, these can be so bad. I've had lots and lots of clients who they'll call me and they'll say, I need to come and see you. I need to book in. I wish I'd done it months ago. I was at the hospital at 2 o'clock in the morning because I couldn't stop my panic attack. That really is anxiety in absolutely full flight, And the overwhelming fear and sense of doom literally has people worried about their lives. Some of the most common symptoms, apart from the extreme, unstoppably racing mind, is heart palpitations and shortness of breath. So you can imagine the physical fear that it starts. So the panic attack starts, the heart starts fluttering, you get short of breath, then that adds to the fear of the panic attack. So it feeds itself on and on, gets worse and worse and worse. Now, feeling faint with panic attacks, in all the years I've been doing this and all the thousands of clients I've seen, I've only ever encountered 2 who have actually fainted. I've encountered thousands who thought they were going to. So the actual risks are very, 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 very small. But when anxiety is in full flight, to be fair, that's usually because the person with anxiety has never done anything about it. That's the thing. So I'm not saying if you're having panic attacks, I'm not saying blame yourself. What I'm saying is, for goodness sake, common sense dictates that you do something about them before anything gets worse. Nothing gets better with anxiety unless you get it dealt with. So how do you deal with panic attacks? How does a good therapist deal with panic attacks? Well, a panic attack is kind of a symptom of the anxiety. And it's, as I've explained, it's as bad as anxiety can possibly get. So the good news is when you start dealing with the anxiety, when you start peeling away the layers of the anxiety, guess what the very first thing to go is? That's right, the panic attacks. That's the very, very first thing. So, for example, you come into a good therapist and you get assessed, all the right questions are asked, you're treated as an individual, as a human being, because everybody's anxiety is different. If I see 10,000 people with anxiety, I can guarantee that everyone's story is subtly different. Some will be completely different, but they're all subtly different. So then in the first session, a decent therapist will begin deconstructing that anxiety by communicating with the parts of your mind where the anxiety lives. We know where anxiety lives, so we know how to release it. After that first session, it is highly unlikely, in I would say 70% of the clients that come to see me, for example, it's highly unlikely that you will have a panic attack again. You might feel a little bit wobbly, maybe once or twice the next week, but because they're the first thing to go, I commonly see clients who often have rolling panic attacks. So they have them several times a day, every day of the week. You get that first session out of the way, which takes about an hour and a half, and the next week, as I say, they just feel a little bit fluttery now and again. Can you imagine how good that feels to go from the exhaustion of constant rolling panic attacks? As I've indicated, it's all about knowing where anxiety lives in there, fully understanding the process, doing a proper assessment, and again, that critical key, I know I'm repeating myself, it's treating the person as an individual. One size does not fit all in any kind of therapy. That is panic attacks in a nutshell. If you need help with them, reach out. They won't, I can guarantee, they won't go on their own. But we can eliminate them quickly. Once they're gone, your mind goes, oh, this is better. Then they don't come back. What's not to love? Speak to you soon.